Okay, so where are the facelift incisions made? So when we're talking about facelifts, we have to talk about the uplift, which is the lower face and neck, and then come back and talk about the endoscopic type of procedures. So with the uplift procedure, there are incisions around the ears, and it depends on the individual as to where I place those incisions. And then there may or may not be an incision under the chin. So sometimes I make an incision under the chin if I'm removing excess fat or tightening muscle bands in the neck. If it's not necessary, then we avoid that incision. So it's not mandatory in everybody. The other thing we're doing is we're making incisions around the ear. So if we take the ear, and we look at the ear, we have the earlobe down here, we have this tragal cartilage here, and then the top of the ear here. If we imagine the incisions, and it again depends on the person, sometimes the full incision would involve being below the sideburn, curving here, inside the tragal cartilage, around the earlobe, up the back with illustrated with a dotted line, and then in the hair itself. Now, not everybody needs that full incision, and some people we may only use the portion behind the ear if we're just doing a neck lift, but if we're lifting the jowl area, we'll use this portion, and sometimes if we need to lift them to the upper cheek, we'll use this portion, but that's the potential full extent of it. Okay, so we're still talking about facelift incisions and their placement. I just explained where the uplift incisions are, and we're going to just talk briefly about the endoscopic forehead and brow, which is the upper portion, and the endoscopic midface, which is the middle portion, or the cheek lift. So with this procedure, with the endoscopic brow, again, it's different person to person, but I'll give you the average type of procedure. With the brow lift, I'm making 5 small incisions. They're very small, 2 on each side in the temples, 2 here above the outer eyebrows, and sometimes 1 in the center portion, all behind the hairline, or if somebody has a very high hairline, sometimes at the hairline. Now these incisions are very small, measuring about this big, just enough to let a telescope that's about half the diameter of this pen enter through it. If we're also doing a mid-face lift, then we're making an incision inside the mouth, up as high as you put your tongue, under your upper lip. So under the upper lip, not visible from the outside, working down from above with a telescope, and working up from inside, and meeting in the middle. So from inside and from above, and lifting the cheek up. And that's called an endoscopic subperiosteal midface lift. So those are the incisions for the endoscopic portion. You can see they're extremely well hidden. These are all behind your hairline. These are inside the mouth, never to be seen. So it provides nice access points to accomplish what we need to accomplish without very large incisions.